It's a common misconception that with bariatric surgery comes diarrhea. While this may be the case for some, diarrhea occurs in a very small number of people. The most common bowel issue faced by the average patient after surgery is constipation. Before discussing this further, it's important that we clarify what true constipation is and what it's not. First off, it's normal to have less volume to your stool and fewer bowel movements in the first few weeks after bariatric surgery. If you're passing stool only every couple of days, but it's easy to pass, you're not constipated. This will just be your new cycle for a while. However, if your bowel movements are only a few times per week and they're hard, and you need to force to pass them, you're probably truly constipated. So it's not about how often or how much you pass. Rather, constipation after bariatric surgery is better identified as passing stool that is hard or painful, or both hard and painful. So there are two phases of constipation: early constipation and late constipation. Early constipation refers to constipation in the first 6 weeks after surgery. This is the time when you're on the full fluid diet, puree diet, and soft diet. Late constipation refers to constipation after the first 6 weeks after bariatric surgery. This is typically when you're on regular textured foods and following the lifelong diet guidelines. So let's briefly discuss both types of constipation. Early constipation, or constipation during the first 6 weeks after bariatric surgery, most commonly happens due to the following 4 reasons. Number 1, not drinking enough liquids. After surgery, it's a challenge to drink the amount of fluids you're used to drinking when your stomach is so tiny, inflamed, and healing. Less fluid intake means harder stools. Number 2, you're eating a very small volume of food. A smaller stomach means a lot less food going in. Less food in means less stool. Number 3, low fiber intake. Less food coming in also means you'll be eating less fiber. Fiber is what helps bulk our stools. In the full fluid, puree, and soft menus, the fiber content is fairly low due to the nature of the textures and the low amount of fruits and vegetables and whole grains. Less fiber means harder stool and less stool. And lastly, reason number 4, new medications and/or vitamins. Constipation can be a result of side effects from some of the medications and vitamins prescribed after bariatric surgery. So what can you do about relieving constipation after surgery in the first 6 weeks? Focus on drinking as much as you can and focus on fiber, but in a way that are appropriate for when you're on the liquid, puree, and soft menus. Be sure to try and drink at least 6 cups of low-calorie liquids daily. Add more fiber to your diet through your smoothies, or you could trial a powdered fiber supplement. Walking is also a great way to get things moving. Even if you're not constipated, these tips can help to prevent constipation from starting. Refer to the content provided to you for more detailed tips on preventing and managing early constipation after bariatric surgery. Late constipation, or constipation when you're more than 6 weeks out from surgery, can be due to all the same reasons that we just reviewed. With late constipation, you can be more aggressive with increasing your fiber intake because you're likely now tolerating most regular textured foods and therefore can incorporate a variety of high fiber foods. Try adding more legumes to your diet, such as lentils, chickpeas, red beans, or black beans. Choose whole grain products such as quinoa, bulgur, or barley. If you can tolerate them comfortably, add nuts and seeds to your snacks and slowly bring in more fruits and vegetables even if they're in small amounts. You may also want to be cautious with your protein supplements during this time. While it's important to get enough protein every day, there is such a thing as having too much protein. If you're still not sure if you need your protein supplements, a registered dietitian can help you. Patients who use 2 or more protein supplements a day often complain of constipation, so it's important to take a look at this. If it's now been a couple of days without a bowel movement and you're starting to get nervous, it's important to know that you won't live with this constipation forever. These tips can help you, but likely won't see a difference from one day to the next. Remember that it's a process and just keep doing your best. If you're experiencing significant problems such as having no bowel movement in 1 week with a lot of abdominal pain, or you're unable to pass gas, or your bowel movements are extremely painful, or you're even developing hemorrhoids, or you have blood in your stool, contact your doctor as soon as possible. You may require medical attention or treatment for your constipation. For more detailed information, look through the written resources provided to read more about constipation after bariatric surgery.